As a point of departure on this one, even though it's not directly related, I'd like to begin by noting the dramatic gains that have been made on average for the retired in the United States. People above the age of 65 have much lower rates of poverty than other groups in society. They stand out for their nearly complete coverage of a national health insurance program. And prior analysis has showed they were largely completely protected from the financial crisis of the 2000s. And I think, as a note was made yesterday, they stand in dramatic contrast to the economic condition of children, for example, in the United States. So I think the result of that is that the major focus of most analysis of the retired today is on the differences. Sort of the things at the margin. On average, the retired are doing very well. In one area in which that has attracted a lot of attention recently is on the issue of mortality. There are different dimensions of it, but I want to just say a couple of things at the beginning of some others. Ann Case and Angus Deaton highlighted the fact that mortality and morbidity is rising among middle-aged people in the United States. Our focus in this paper is much more on the mortality experience of older Americans, not the same group as theirs. What we have done is very closely related to the paper that was presented by Raj Chetty yesterday. In fact, you might wonder if I really got anything left to say after he gave that presentation. In Case and Deaton, just to say a few things more, that they found there's dramatic improvements in mortality for blacks and Hispanics, but nothing for whites. You can see this in this chart. The mortality rate has gone down quite dramatically over the last 15 years for them, but it's gone up for white Americans. One way in which this stands out, as I said, they're focusing on the growth from 45 to 54. I just found this chart very dramatic. This shows you the mortality experience over time of people in a bunch of other high-income countries, American whites and US Hispanics. And you can note it's just a sharp break from the experience you see elsewhere. And that's the focus of their analysis. Here, if you go up 10 years older, which is closer to the group we're going to focus on, you find out that the experience of mortality among Americans has been much closer to that of other countries. They attribute this mainly, I think, to the rising problem of drug addiction that has beset a lot of middle-aged white Americans, particularly in the middle of the country. We want to focus in this case, though, on mortality differences by SES. The first thing I think to note is that death rates are higher for people who are rich than they are for poor. There's no particular surprise in that, and I don't really want to focus on that dimension. Raj Chetty showed that yesterday as well. But instead, our interest is in the fact that the gap between the rich and the poor has been growing steadily over time. And that's a surprise because up to, it looks like about 1980, a little hard to be precise because we have limited data on this phenomenon, but for a long time the differentials were narrowing, probably because of the expansion of the public health system in the United States. So in the period, say, from 1900 up to 1980, somewhere in there, that differential was narrowing. But a lot of research done since then finds a widening gap in mortality between different socioeconomic groups since that time. In this analysis, we're going to look at sort of using a different data set, the robustness of the finding of increasing differential mortality, and we're going to incorporate two alternative measures of socioeconomic status that we had access to. One is education, and the other one is people's career earnings, which we're going to take, as I'll explain in a minute, as a proxy for permanent income. And then at the end, I'd like to say a few things about the implications of the results for a recalibration of the Social Security system now that it's running into severe financial difficulties. The basic data we're working with comes from the Survey of Income and Program Participation for the years 1984 through 2004, and that data has been matched by the Social Security Administration to the Social Security earnings, death, and benefit records. And we had access to that. We have roughly speaking, and we're only going to look at people over the age of 50, partly because mortality is pretty uncommon. I thought when I started on this that I learned that I was sort of wrong, that mortality had been rising for those younger people. But when we started doing it was, so we have about 1 million person observations in this data set of people's 1 year at a time mortality experience. We have 2 measures of the SES, as I mentioned. Educational attainment is a really nice measure, and most of it, because it's so predetermined. It comes usually pretty early in people's life, and it's certainly way before they get to age 50 that most of their educational attainment is set. The problem with education is, I think, 2. 1, very limited variation. There's just very heavy clustering of the data around a high school graduate, a college graduate, and a small number of people with postgraduate training. So it lacks some variation in some of the middle ranges. And there has been an upward trend to educational attainment over time. We removed the trend by standardizing people's educational attainment on a scale and then taking it and dividing it by the average for that age cohort as a centered moving, 5-year centered moving average. The other one we have is mid-career earnings. This comes from people who have been matched to the SIP data from Social Security records. For the data set as a whole, we have a match of about 90%, but there was a much lower match in one other year, 2001. They had more problems. I like the measure of earnings 41 to 50 because it reduces the role of transitory income, and I think it comes close to the notion of permanent income type concept, that we're going to use it that way. One of the big problems with Social Security earnings records is it used to be that the earnings was capped at a very low level. And the Social Security Administration's data on earnings came from their own records, not IRS records. And so they had no information on people's earnings once they got to the cap, and they were lost. And that was a big deal back, say, in the 1970s, where around 50% of the population of wage earners hit the ceiling. It was very low. Today, it's been raised to a higher level. Today, there is no cap because we get the data from the W-2 records starting in 1979-80 with a switch over. But we have made use of, for the earlier years, Social Security Administration collected information. They knew the quarter in which people hit the ceiling. So they got data every quarter, and so they could tell you 4 digits, think of it that way, for quarter 1 through 4. If you paid taxes, you were in there as a 1. And we used that information to adjust the earnings up. Now there's problems, of course. It's just going to be clustered around the midpoint for each of those 4 intervals. But since we're averaging over a 10-year period, I don't think it's a very big problem. I've played around with it some. It looks to me like it's a pretty robust way to adjust the income data. And of course, we have no way of adjusting way up at the top. Once they hit it in the first quarter, that's all we got. We used some information from the CPS to try to figure out where the midpoints were on that. It's not very good because probably the CPS didn't get the people at the very top like that either. But since 1978, we've had actual W-2 earnings. The other problem we have with it is that in the early years, a lot of women didn't work. So if they were married, and so we don't have Social Security earnings records for those people, and there's a very pronounced trend over time for women in that regard. We handled that by, that's where I guess the concept of social economic status came from. We combined them together into household income. So we take the husband's income, the wife's income, sum them, and take the divide by the square root of 2. This is the raw data on mid-career earnings, and you can see for men, it was trending up. It's not a constant, even though it's been deflated to real values, real wages, mainly because I think that the index of average wages was not exactly the same as the people who were included in the Social Security system. And so there was an average to it. We did the same thing for earnings as we did for education. We removed this effect by dividing through by a 5-year standard moving average to make it trend-free. And you can see when women started to rise quite dramatically as a share, then the men's income tends to go down in that thing. We wanted to take out both of those effects. So both of them are standardized on their own gender and then combined together. To try to do the mortality, it's the same as Raj Chetty did yesterday, same measure. We're looking at basic Logit regression, where we're going to take the 1-year mortality rate as a function of a bunch of various indicators of people's economic and social condition. We can use career earnings, educational attainment. We know their age in each year, of course. We know their birth year, which we're using as a cohort effect. So we turn out to be very interested in distinguishing between people by birth year, their marital status, and we can include or exclude people with disability. And we use the interaction between SES and birth year as the basic measure of rising or narrowing over time of the gap in mortality rates. So think of it as if we were doing age, mortality is a function of lifetime earnings, the birth year in which people were born, and then the interaction of lifetime earnings and birth year. And it's the sign of that coefficient on the interaction term that determines whether the gap is widening or narrowing. Here shows some probabilities analysis from that of the estimates of mortality. This is for at 2 ages, just sort of solving out the relationship to see what does it imply, right? And so the first one on the left there, for some reason in making the chart, the labels are missing for the top group, but the top group is the one with the diamonds down at the bottom. Always seem to have problems translating it over a PowerPoint graph. But you can see you're following the different birth cohorts from 1920 up to 1945. We had data, by the way, the birth cohort we started with was 1910, but it's been indexed to 1910 equal 1 in this thing. And we go up to people born as late as 1950, and that comprises the data set we're looking at. You can see there that for the bottom income decile, I think the interesting thing to note, the squares at the top, it's almost flat. There's not much of an improvement in mortality over time. And at the top, it's more dramatic. There's a very pronounced fall in the mortality rate for men at the older ages. Then you can do the same sort of thing, just solve it out to figure out what is the mortality rate at age 75. And you can see it widens out. It's, of course, much higher. The probability of dying does go up quite a bit with age, but the interest we have is in the differential between the two. Here's exactly the same thing for women. And if you thought it was kind of flat at the bottom for men, it's very flat for women at the bottom. Essentially, low-income women, in this case, I think, we are working with the income measure of SES. There's essentially no improvement and mortality rates over time, but still big improvements for people at the bottom. That's kind of confusing. Here's another way to look at what we're trying to do, just puts it into bar charts. And here we take the life expectancy of people who were born in 1920 and compare that with people who were born in 1940. So both groups are very much within our data set, the sample period that we're looking at. And you can see down at the bottom for men, there is an improvement in the lowest quintile of life expectancy, but it's only about 2 years. And then at the top, it's about 8 years. Very much the same sort of thing. When Raj Chetty gave his numbers yesterday, I was noticing how almost exactly similar we are in the magnitudes we think of this effect. And here, you can see it for women. And here, it's very noticeable that women at the bottom of the distribution aren't doing very well. There's been almost no improvement in their mortality situation, in life expectancy. And if you put this together, then you can look at it this way. You can see that at all levels, men are gaining relative to women. They're catching up. What used to be this big difference in life expectancy for women is beginning to go away. Not go away is an exaggeration. It's beginning to narrow. And it seems to be true all through the distribution. That's the basic results that we got on mortality. We think that there is very strong evidence. In the paper, we have more details about education as well as income. But I think the evidence has become quite overwhelming now that this phenomenon is going on of increasing gap in mortality. The other one I think that's sort of interesting, and there's some other discussion, we find there's not much role for race once you take account of people's income or education. Particularly for women, in the regressions that we do, race is a significant variable for men, but it's no longer a very significant predictor of mortality rates for women. So the racial differences for women seem to be vanishing in that sense. We also, not in this paper, but in an earlier paper, we looked at using HRS data. This results is based on the SIEPR. But we did use the HRS in the past. And the nice thing about the HRS is it has a whole bunch of indicators of people's health status and a self-reported health variable by individuals, all of which, when we include those in the regressions, are highly significant determinants of mortality. They all play a role. The strange thing is they do very little to narrow the gap, or the trend, I should say, in the gap between the rich and the poor. That interaction term that I mentioned earlier continues to be very powerful, even after you take account of some of these things about health conditions. And so it doesn't seem to do much to reduce the role of SES. Although certainly if you're looking at women, I think the big thing at the bottom has to be the interval we're looking at. So many more women were smoking at the end of the period than was true at the beginning of the period, whereas men are going exactly the opposite. The male rate of smoking was going down, the rate for women's going up. I think that works, but it doesn't explain in this data the growing gap over time. The other way then of looking at it, we wanted to look into what does this do for the distribution of benefits. I'm running out of time, so I'm going to do this quickly. This is a measure just to show you over the household earnings deciles. The black line is people's income, career earnings measure. You can see very sharply upward sloping, particularly at the very top. Then the red dashed line is annual benefits, which flattens out, as we all know. The system is highly redistributional, so there's no surprise there, right? And then we use the information that we got about life expectancy and these different income deciles to calculate how many years they would expect to be receiving benefits. And you can see the lifetime thing is it undoes some of the redistribution effects, but still quite a bit of it remains. This is another way of looking at it. This goes back to the people in 1920 birth cohort, 1940 birth cohort, and distinguishes just what happened to the lifetime equivalency. And you can see for the people born in 1940, it's getting much more progressive. I mean, related to income, rising over income classes than it was before. So we've lost some of the progressivity. It seems more pronounced for men in this particular example than it is for women, mainly because women's life expectancy has not been going up that much between these 2 decades. The conclusion then is that we find is that the life expectancy between the top and the bottom is large, and it is growing rapidly. And it is offsetting a portion of the progressivity built into the Social Security system. But I personally find, I'm still struck, it is a highly progressive system yet. This has reduced it, but it has not gone so far as to undoing it in many respects. I think also, at this point, we don't have a credible explanation for why this differential mortality is occurring and why it's growing over time. For Social Security status, I think the real question it raises is the most common focus that everybody has for fixing the financial problems of Social Security is to raise the retirement age for everybody. That sounds like a very good idea for us. We're living a lot longer than we used to. But for people at the bottom of the distribution, there was no increase in their life expectancy. It is just a benefit cut for them at the bottom. And it is people at the very bottom for whom Social Security is an absolutely crucial source of income in retirement and accounts for the fact that the poverty rate is so low in the United States. So you can question, I think, the fairness of the proposal to simply increase across the board the retirement age without doing something about making adjustments for the benefits for people at the bottom of the distribution. Or perhaps it would shift the focus instead over to, if you have a financing problem, you would normally want to address it more on the revenue side than on the expenditure side. Let me stop with that. Thank you.